Joe. Today we are going to be talking about bronchiolitis. This episode will be geared more towards our infant and toddler population. Bronchiolitis is a fancy term for baby cold. It is a seasonal disease brought out mostly in the late fall and early winter. It is caused by the majority of the time by the respiratory syncytial virus or RSV. However, there are many other viruses that can cause bronchiolitis. Bronchiolitis is, like I said before, a fancy term for a baby cold. Babies, though, are what we call obligate nasal breathers, so despite the congestion, they still try to breathe through their nose because they do not know how to breathe through their mouth, and with that, they start to show signs of respiratory distress with breathing faster or tachypnea and signs of accessory muscle use, such as sucking in on their ribs, flaring out their nose. Now, this disease is progressive, and it usually lasts about 10 to 14 days, and it peaks around day 5 to 6 of illness. With that, you'll start to see your baby getting signs of respiratory distress. Now, babies that we want to see in the office are babies that do progress to showing signs of respiratory distress or breathing faster despite supportive care measures such as the bulb suction, Vicks Vapor Rub, the nose Frida, or if your child is older than 6 months, the hydroxyzine or Atarax. Now, in the office, we will again check their respiratory rate, check their respiratory status, make sure they're not showing signs of worsening distress. Occasionally we can try albuterol. Albuterol is controversial in the treatment of bronchiolitis, as in case to cases every baby reacts differently. Some babies improve and some babies do not show any changes despite albuterol treatment. Now, babies that we see in the office that show worsening signs of respiratory distress will occasionally wind up needing to be hospitalized. Now, the criteria for hospitalization are showing signs of worsening respiratory distress, signs of hypoxemia, which is low oxygen in the blood with our pulse ox in the office, or signs of dehydration due to the poor feeding due to the congestion. Now, babies that wind up in the hospital will most of the time require deep suctioning from wall suctioning. Also will try albuterol again, and sometimes we'll need IVs to help with their maintain and restore their fluid balance. Now, like I said, babies that show worsening signs of distress can wind up in the hospital, but sometimes they turn the corner in the office and sometimes do well with just supportive care measures. I hope you find this helpful, and like I said, any baby that is showing any signs of worsening cold symptoms, we like to see them in the office. Thanks, and have a good Thanksgiving.